So sleep apnea, you take care of it in your practice, and I guess for people that don't or can't wear CPAP machine. So tell us what you do.
Which is 60% of the population.
Really?
Or 60% of people that have CPAP are non-compliant, means they don't wear it.
Okay.
So they're at risk for sudden heart attack in the middle of the night and dying. So what we as dentists do is, as dentists, we see patients more often than the physicians do. They're coming in an ideal world, every 3 to 6 months for maintenance. So we're on the forefront. We're on the front of picking this problem up and also helping treat it. So, and what we do as dentists for the mild to moderate cases is the first line of treatment, and that's a mandibular advancement device, MAD is what it's been monikered. And what that does is it brings the jaw forward when the patient's sleeping at night. Because what happens is when they're asleep at night, they lay down to go to sleep, everything relaxes, your muscles relax, your jaw drops backwards. You may have a narrowed airway because of a whole host of reasons. Could have to do with weight, could have to do with just your normal anatomy, and the airway closes off, and then you may be gasping and quitting breathing 30, 40, 50 times a night. And your significant other would hear that as snoring, or snoring and then a cessation of breathing, which is really dangerous. Dangerous on the heart because the heart rate goes up and it wakes you up and you wake up tired and you're at risk for heart disease, diabetes, weight gain, and even cancer has been linked to this, increased risk of cancer. So it's a serious, Randy, it's a serious problem.
Okay.
Yeah. So what we do to help patients with this problem, we offer a complimentary sleep evaluation first visit, and we do pharyngometry and rhinometry. That's just an acoustic test of the nose, the nasal airway, because that's important to see if it's open or not.
Okay.
And then the throat, the airway going down into the lungs to see if it's open or not, and if it collapses. And then we can make a suggestion based on that and their symptoms and their drug history and medical history. Does it make sense to do a home sleep test? And we can send them, we have the capability in my office to send them home with a home sleep test versus going to a center and spending the night in a strange environment where they don't sleep very well.
Okay.
And we can get the results back, and we can know literally overnight the next day if they have it and what category, are they mild, moderate, or severe. And we know that we can successfully treat the mild and moderates with a dental appliance that's custom fit and then custom adjusted, we call it titration, to their individual situation with the diagnostic device that we talked about, the pharyngometry. We can put that device in their mouth and then retest them to see, okay, now is the airway open and open optimally. And what's really cool about that technology, it allows us to custom fit the device as to how much we're opening them and how much we're bringing the jaw forward and really dialing it in precisely. And not too many people have that technology.
Okay.
It's not widespread yet, but we're one of the offices that has it.
So with this person, okay, so they lay down at night, their tongue drops back, their jaw, so you're basically with an appliance opening it up a little bit.
Opening up that airway.
And they breathe better, and now they sleep better.
Yes, they do.
So people, and you were saying people wake up.
I wear one myself.
You wear one yourself?
Yes, I do.
Okay. So they think they're sleeping, but they're waking up like 30 times a night.
Or whatever that number is, yeah.
Okay.
15 to 60. I've seen as much as 70.
70 times a night they're waking up from snoring.
And their oxygen's going down. So oxygen goes down, heart rate goes up.
So they wake up tired.
Yeah.
So do you have stories of people, you made this appliance and all of a sudden they're going, I'm back?
Had one this last week. The wife, he's been a patient of mine for 30 years. He's gotten older, and we suspected he had the problem. He has a history of snoring. His wife now says, he's not snoring anymore, and he reports a lot more energy. He's a lot more rested, sleeps better. It's amazing. And we're just dentists.
So no more CPAP for some people.
For some people. CPAP
works.
CPAP works really good and is totally appropriate for the severe sleep apnea.
But if you can't wear it, try this.
Exactly. It will help. Yeah.